Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about explaining the American Health Information Management Association exam pass rates. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so Ahima has released the latest pass rates for their certification exams on their website. And I wanted to take the time today in today's episode to explain what these numbers mean, because if you are going in and looking at the website, doing your research about these certification exams, and you see these numbers, it can be quite overwhelming, and it can actually cause a lot of people to just forget about taking the exam altogether. And I really want to kind of mitigate that by explaining what these numbers actually mean and how it is just something to kind of help you to understand the seriousness of these exams. Now, I am only going to be discussing 3 certification exams with Ahima, because these are the medical coding certification exams. The rest of them are the degree exams that they have, and they also have their specialty credentials as well, but I am not going to focus on those today. I am only discussing the 3 medical coding certification exam pass rates, okay? So we're going to start off with their entry-level credential, the CCA, that is a Certified Coding Associate credential. This is a great credential. This credential says that you have the entry-level competence to get a job in either the inpatient side or either the outpatient side, because it tests you on both ICD-10 PCS and CPT, okay, when it comes to the procedures. And of course, ICD-10 CM, your diagnosis coding, is always covered on these exams. But this exam covers both of those. Again, it is saying that you have the entry-level competence. This is a credential that I started off with. This is a great credential. It doesn't matter what you hear or what anybody says about this credential. This is a great credential. And a lot of people who are, have great careers have this credential. I know I did. When I started again, I had the CCA. So I want that to be known right out of the way. So if you want to start your career with the CCA, that is totally fine. It takes endurance to get a job when you are looking for a job. It has nothing to do with what credential you have. If you have one of the 4 main ones, you're already, in a good path. And the four main ones being the CCA, the CCS, or the CCSP, or if you're taking your exam with the American Academy of Professional Coders, the CPC, okay? So those are the main 4 that I recommend. So the pass rates for the CCA as of 2021, it went from 2,104 first-time test takers for the CCA. 74% of them passed. But the year before that, in 2020, there were 1,627 first-time test takers for the CCA, and 85% of them passed. So I want you guys to notice something. The numbers did drop. So there's a couple of reasons why this happens. Keep in mind that these are the 2021 numbers, which means that the student was probably either studying during the pandemic in 2020 or in the early part of 2021 when they took their exam. So these are all the people that are factored into this number. Now, yes, the pandemic messed up a lot of people because a lot of the schools were shut down and we started learning virtually. Now, I say all the time on my channel that you really do have to prepare yourself for these exams. And these exams require us to have a vast amount of knowledge in a short amount of time, which is why I recommend going through a program that is 9 months, 12 months, or 18 months. And it does not matter to me if you have a medical background or not, because even nurses who get into this field have a hard time understanding medical coding. Medical coding is something completely different, and it takes a high level of skill to be able to understand it. So we have to know what doctors know while never having gone to medical school. And I say this because we have to read these op notes, and we have to read these encounter notes, and we have to really understand so that we can find the correct codes. Now, it's not just about looking up the codes in the book, it's actually understanding anatomy, medical terminology, pathophysiology, and physiology, and everything else that goes into these things. So the reason that it probably dipped was because people were not having that one-on-one in the classroom type deal. And then sometimes it's just, well, I'm just going to take this because I think I can pass it, and I went through a really short program, and then they see that they cannot. Another reason is people are too dependent on the Ahima prep books. Now, I love Ahima, all right? I'm with Ahima. I have 2 certifications with Ahima currently. I have the CCSP and the CCS, and both of those I passed on the first try last year. So the reason that I say y'all are dependent, some of y'all get dependent on these prep books, I have gotten the angry letters from people that said, I bought the Ahima CCA, CCS, or CCSP prep book, and none of those questions were on the exam because they are not supposed to be on the exam. These are meant to prep you. These are not meant to you memorize these and those are your answers, okay? Because then everybody could pass and there would be no barometer of do these people really understand what they're doing, okay? So that's why none of those questions that are in the practice books are on the exam. You have to pay attention to the domains and what they're covering, all right? So if you do that, then you can adequately prepare yourself. I have recommended many times on my channel the books that I recommend to study with. They are in the description box below. If you ask me, I will direct you to the description box below because they are there. You don't have to click on them. The title is there, and you can find them however you find your books. The Amazon affiliate links are there. You do not have to click on those links, all right? But yes, so these tests are very difficult, but I want y'all to notice something, that it went from 85% to 74%, and there were more test takers in 2021, okay? But it gets better, right? And better, of course, I'm being facetious. Now, we're getting into the CCSP. The CCSP is a Certified Coding Specialist, physician-based. This says that you have mastered the outpatient side. This says that you know your ICD-10-CM, you know your CPT, and you know your HCPCS coding. So it covers everything on the outpatient side. There are no questions about MSDRGs or anything like that because that is on the inpatient side. There are no ICD-10 PCS questions on this test either because, again, it covers ICD-10-CM, CPT, and HCPCS. Now, in 2020, this had 266 first-time test takers. 67% of those passed on the first try, okay? 67%. So that's not looking good, right? Those odds still don't look very good. But because this is a mastery, and a lot of people don't take that seriously when you're looking at the domains, you have to take it seriously, guys. Know your code ranges. You have to have speed because these exams are broken into 2 parts. There's a multiple choice, and then there's your case studies, and that is for all 3 of those exams, right? So then you want to make sure that you are testing yourself with the speed. You need to be putting in 20 hours a week of study. I don't want to hear that you have a full-time job and that you have a family. There are people who have full-time jobs, have families, and they still manage to squirrel in that time. Because if you really truly want to do this, you have to make the time. And you can find those pockets. I've done the show before about finding study time for busy people. I've done that episode. And when you're driving in a car, you can listen to something through your phone. You can listen to YouTube channels that cover medical terminology, anatomy, and pathophysiology. There's even a channel on YouTube that covers HIPAA. All right, so these are all things that are very, very important and critical for coders to know. And if you are struggling trying to find codes, you don't understand what you're doing, it is your responsibility to find a tutor or find a mentor who can help you. Now, if your school was supposed to be the one to train you and help you, and they're not training you or helping you. It does no good to sit there and complain, the school is not helping me and my teacher won't help me and I'm just going to give up. If it's easy for you to give up that quickly, this is not the field for you. And I'm just being blunt and honest about that, because this takes a lot of self-endurance where you have to go and do these things on your own. And again, this is possible to learn on your own, but again, there's some people that need somebody to help and explain it to them. There's a ton of tutors on LinkedIn. I'm a tutor myself. My rate again is in the description box below. So if you want to check it out, by all means, let me know. But in 2020, there was a 67% pass rate. In 2021, there is a 42% pass rate for the CCSP. That is really not good. This says that people are not studying enough on the domains. They are not comprehending what's going on these exams. I'm probably part of this 42% because 2021 was when I took this exam. So I'm part of that very small percentage of people that passed it on the first try. Now, again, I have experience as a medical coder, but you don't have to have experience in order to pass the test on the first try. I had no experience when I took the CCA many moons ago, and I was still able to pass on the first try. But out of my whole class of 35 people, I was the only one to pass on the first try. So that's saying a lot about these tests. When I'm telling you guys to read your coding guidelines once per week, I mean it. Because these exams, they are going to ask you questions and they're going to test your skill and your knowledge and your ability to be able to recall. If you don't know your coding guidelines, it is going to make your ability to be able to look up codes a lot harder, because you're not going to know about sequencing, you're not going to know about the guidelines, you're not going to know about any of those things if you have not been studying those coding guidelines. And people will fight me. Oh, Blue, I don't want to do that. And okay, if you don't want to do that, then again, you're setting yourself up to fail. Please make sure that you are taking the time to read those coding guidelines. The more that you read them, the faster you will be able to get through these exams. When I took the CCSP, I had an hour and 10 minutes, hour and 20 minutes still left on the clock to go. That's how fast I made it through that exam. And again, it could be because I'm a studier. It could be because I've had experience. But when I took the CCS exam, I had 8 minutes left on the clock. It is roughly 2 minutes per question. And so not all the questions are going to take those 2 minutes. You're going to be able to know the answer right away and you can click it and move on. But there are some where you're going to have to really kind of look at them and read them and make sure. Okay, so just the more that you read, it's like a muscle, the faster you're going to get. It's all about building endurance, knowing your books, being very familiar. For those of you who are writing, highlighting, and tabbing your books to heck and gone, that is a problem, because that says to me as a veteran coder that you do not know your books well enough. It takes time and energy to tab, write, and highlight. And those books, when all you need to do is study those books. You do not need all these notes. These books are written, or these manuals are written by scholars, by doctors, by very intelligent people, and it has all the information that it needs. It does not need you to add anything to it. And if you tell me, well, Blue, this is just how I learn, that may be all fine and good. This is why you have workbooks. These books should stay clean. And if you're reading the candidate hand guide on the Ahima website, it says that the tabs that you use, you can use tabs, but they have to have come with the original book. The AMA CPT Professional Edition is the only one that I see that comes with its own tabs. The Optum 360 coding books that I do recommend, they do have the dividers for the tabs, but again, if you are using your book, you're going to be very familiar with that book and you're not going to need them, and the tabs will actually get in your way. So that is my advice anyway. You guys can do whatever it is you want to do, but I am a 3-time first-time test taker who passed all 3 exams on the first try. So I know a little bit of what I'm saying, okay? But that's that one. Now for the big kahuna, the Mastery Credentialed CCS, the credential that 99.999% of employers will ask for. And I say 99.999% because sometimes leaders think it's okay to be discriminatory towards other credentials because they want everybody to have the same credential that they have, which is not right. Because in this industry, it's not about the credential that you hold. It's about the knowledge that you have. I've seen people who have the CPC who struggle. I've seen people who have the CPC who do really wonderful and are very intelligent and know a lot and can teach other people. I've seen the same thing for CCAs, CCSPs, and CCSs. So again, having credentials does nothing. It says nothing unless you can back it up. For me, I've been a veteran medical coder since 2008. That's when I got my very first certification, and I can back up my credentials. I can back them up because I have the experience, I have the knowledge, I have the know-how. I've been studying ever since then. I've been a continuous student this whole time. If you are not continuing to study after you've gotten your certification, you're in the wrong, because you're going to find out that we always have updates all the time. So in order to stay ahead of those updates, you have to continue to study. Now, for the last one, in 2020, there were 2,374 first-time CCS test takers. 83% of them passed. But in 2021, there were 2,250 first-time test takers. 42% of them passed on the first try. 42, and I'm one of that 42%. That's bad. That is really bad. Because again, it shows that people who are going for these exams are not developing their competence before going to sit for these exams. You have to develop your competence. You cannot run through one of these quick 6-month, 4-month programs that promise that they can help you to pass this exam. This exam is very tough. And for me, a veteran coder, again, that I'm pretty quick at reading, I still had only 8 minutes left on the clock. It is a 4-hour exam. These exams do not fool around. When it comes to time, you have to be in there. You have to pay attention. You have to know what you're doing. And if you don't, the result is not very good, right? If you can't pass it. These are expensive exams to be taking over and over and over again. Make sure that you are doing your drills and you're doing practice on timing, and you're looking in the description box for the books that I have recommended. And last week I did a whole recommendation video on each book, right? On the ICD-10 CM book, the ICD-10 PCS book, the CPT book, and why I like these books, the particular books that I've mentioned. And I go through and I show you all the different things that are in there. I do recommend, if you're studying for the CCA or the CCS exam, that you get the Optum 360 ICD-10 PCS book. Now, in the back of that book, in Appendix M, they have a whole list of all of these quizzes that you can do, that you can look up these codes. That is what was part of the reason that I was able to pass, because I took the time to research and look up all of these codes in the back of that book. And Appendix N, the next appendix, has all the answers, and it does have some of the rationale for some of those questions. So it'll kind of explain why. And it's so important, guys, to have good tools. And the ICD-10 PCS, the spiral bound from Optum, is allowable for the Ahima exams. So if you need that book, the spiral bound book is the one that is allowable. The one with the flat edge spine is not allowed, okay? So just so you guys know, it has to be the spiral edge book. Now, these exams should be taken very seriously. And when you pass these exams, it says a lot about your knowledge base. It does not say that you are a fantastic coder just because you can pass an exam. that will be proved when you are in the real world and you are confronted with op notes that have the incorrect title procedure, because the procedure that's describes another procedure. And if you don't catch that, again, that makes you a bad coder, because you are supposed to read the op note. It doesn't matter how much productivity is demanded of you, accuracy always comes first. And that is part of the Ahima standards of ethical coding, is that accuracy is above in everything else. It is always going to be accuracy first. And if you are in a place where the productivity standards are incredibly high, I've seen employers try to pull this. I think it is ridiculous, because at that point where you're trying to code 200 and 320 per day, that's not even coding. You are just doing data entry. But keep in mind, for all the ones that you data enter at 200 and 320 per day average, you are still responsible for all the codes that are being selected. So if they are wrong, guess who they're going to come and talk to? You, not anybody else. And it doesn't matter if your supervisor or somebody else said it. We have to follow the Ahima standards of ethical coding, and that is all medical coders, whether you are certified with AAPC, whether you are not certified, or whatever your situation is. If you act in the capacity as a medical coder, you will follow those standards of ethical coding, which says that you will look at that documentation and make sure that the appropriate codes are being selected. And if the documentation is bad, that's when you need to talk with that provider. You need to get some education going, okay? There's a lot of things that medical coders do. We wear many hats. And because we wear many hats, you have to be prepared, which is the whole basis of my channel. Which is why I talk to you guys about being assertive in a good way, in a professional way, and making sure that you know your books, you know your coding guidelines. Because when you know your coding guidelines, no one can mess with you, because you'll know and you'll be well educated. And you don't ever say to your providers, I don't know. Because people that are not ready, they will say things like that. And then you see the results in the numbers, guys. The numbers don't lie. 42% is a very scary number for a first-time pass rate. So make sure that you are studying, that you are working on your timing. Look in the description box for all the books that I recommend. The self-study list has all the books, again, that I recommend. So look at the domains. Make sure that you're proficient in all the domains. And again, get that practice in. Keep your books clean. And that's just my advice anyway. So I'm going to wrap this one up. If you are studying on your exams, best of luck to you. You can do anything that you prepare yourself well for. Nothing will be handed to you in this career life. Nothing. Everything you will have to work for. But it is worth it, and it is a great field. But you have to be responsible too in that. I'm just saying. So if this video helped you, please like it, subscribe, share if it helped you, and I will see y'all next time. Bye.